Hey everyone, welcome back to The Explainer. Today, we're looking at a medical breakthrough that honestly sounds like it was pulled straight out of a sci-fi movie. We're talking about the creation of the world's smallest pacemaker. And when I say small, I mean literally smaller than a single grain of rice. It's a device that doesn't even need batteries, and get this, it's actually activated by a beam of light from outside your body. So if you've ever wondered how modern bioengineering is pushing the absolute boundaries of what's possible to keep the human heart beating, well, you are in exactly the right place. Okay, let's dive into this by starting with Section 1, the pacemaker problem, and the hidden risks of current technology. To really grasp why this new invention is such a game changer, we first kind of have to look at the current standard of care. Look, there's absolutely no denying that pacemakers are incredible, life-saving pieces of tech, but fundamentally, they have a pretty massive physical footprint. Right now, a traditional pacemaker has to be surgically implanted right under the skin, usually up near the collarbone, and from there, it gets wired directly into the heart muscle using these long, physical cables called leads. These setups are, frankly, pretty bulky. And because they require invasive, risky procedures to both put in and eventually replace, they introduce a whole host of potential medical complications. And those complications become incredibly daunting when we look at who actually needs pacemakers the most. We're talking about highly vulnerable, high-risk patients. Elderly folks whose bodies might not bounce back so easily from invasive chest surgery. And on the other end of the spectrum, newborn babies suffering from congenital heart defects. I mean, just imagine having to surgically implant a bulky metal box and snake wires into the tiny, fragile heart of a newborn infant. It's heartbreaking. The initial implantation, and honestly, just as importantly, the future removal of these devices, are highly, highly prone to complications. To really put the severity of this into perspective, consider this wild historical fact. The extraction of those pacemaker wires, the leads we just talked about, is notoriously dangerous. In fact, surgical complications resulting from lead extraction are exactly what led to the tragic death of the legendary astronaut Neil Armstrong. Yeah, if a procedure is that dangerous for a healthy, robust adult, you can completely see why the medical community has been desperately searching for a safer alternative. And that brings us to Section 2, a syringe-sized solution, and a major breakthrough from Northwestern University. And this brilliantly illustrates the massive paradigm shift we're talking about today. Instead of the old technology, the bulky, wired stuff that requires invasive surgery, we now have this completely new innovation. It was developed by a team at Northwestern University led by bioelectronics pioneer John A. Rogers. They basically set out to solve the problems of the old tech, creating a device that is completely wireless, smaller than a grain of rice, and, as incredible as it sounds, it's actually implanted by just being injected through a syringe. Let's just take a second to look at the sheer scale of this thing. 1.8 millimeters wide by 3.5 millimeters long. Really think about that for a second. It is literally so small that it can fit right into the end of a syringe. Now, sure, it's a slightly chunky syringe, but the medical implications here are just staggering. Because of these tiny dimensions, a doctor doesn't need to crack open a patient's chest at all. They can just inject this microscopic pacemaker directly into the heart muscle itself. No surgery required. Which naturally leads us to Section 3, how it actually works, specifically looking at power and activation without wires. Okay, so you're probably wondering, if this thing is smaller than a grain of rice, where on earth does the battery go? Well, the crucial point here is it doesn't have a traditional battery at all. Instead, it's powered entirely internally by what's called a galvanic cell. Now, a galvanic cell just uses two metals of different reactivity. Inside your warm, wet body, as the more reactive metal naturally oxidizes, it releases electrons. Those electrons are then scooped up by the less reactive metal, and what does that do? It generates an electrical current. It is essentially just simple, beautiful cause and effect chemistry that powers the whole device from within, meaning absolutely no need for bulky external batteries or wires breaking through the skin. But then the question is, how does it know when to actually fire? The activation mechanism here is just pure genius. It relies on a super clever three-step process. Step 1, the patient wears a soft, flexible little patch right on their chest. And that patch is constantly, quietly listening for a weak or irregular heartbeat. Step 2, if it does detect a problem, the patch sends a pulse of near-infrared light straight through the patient's skin. This light can safely pass up to a couple of centimeters into the body without any issues. And finally, Step 3, that specific light pulse hits the tiny injected device, triggering it to release a current and stimulate a perfectly regular, healthy heartbeat. I actually love this quote from our source material because it just perfectly captures the whole vibe of this tech. They described it as being kind of like having a miniature Dr. Mike on standby with you at all times, ready to give chest compressions. It's basically automated, constant cardiac monitoring and intervention, just working quietly in the background without you even feeling a thing. Now, what's really interesting about this next slide is that it reveals the ultimate climax of this technology.
Remember earlier when we talked about how incredibly dangerous it was to remove old pacemaker leads? Well, get this. This tiny injected device is made solely from materials which safely dissolve in the human body over time.
It basically acts like a life-saving version of a Listerine strip. Once the patient has recovered, or, once the device just isn't needed anymore, it literally just melts away into harmless byproducts. No secondary extraction surgery, no yanking dangerous wires out of a fragile heart. The risk of removal complications absolutely plummets to zero. It's amazing.
Let's move to Section 4, the future of heart tech, and the actual timeline to reality. So I know this all sounds totally perfect, but we have to ask, when can doctors actually start using it? Let's see how this builds out practically and maybe temper our expectations just a little bit. Right now, this tiny pacemaker has only been tested in animals, but that's a crucial first step. Over the next few years, we're going to see this move into rigorous clinical trials. And then, on the future horizon, following successful human trials, the goal is for it to finally be approved for use in everyday patients. While everyday use might still be a few years out, it leaves us with such an incredible, thought-provoking question to close on. Are we basically on the verge of getting our own miniaturized arc reactor? I mean, the kind of wireless, glowing internal tech we've literally only ever seen in comic books is right now transitioning into very real, very life-saving medical science. And that is absolutely something worth keeping your eye on. Thanks so much for joining me for this explainer. I really hope you found this deep dive as incredibly fascinating as I did.